Welcome to the FAB Center for Innovation 21st Century Learning Community Interview Series. In each video, we hear from public health leaders about their work and what they've learned. I'm your host, Naomi Rich. Today, we discuss how colleagues in North Carolina, Virginia, and Nebraska are building new training and relationship building programs for interns and full-time employees. With me today are Jeff Stover, the Chief of Staff at the Virginia Department of Health, Susan Bockrath, Executive Director at the Nebraska Association of Local Health Directors, and Erin, the Health Director and CEO at the Cabarrus Health Alliance in North Carolina. Thank you all for joining us. Erin, tell us how you've assessed the needs of employees at the Cabarrus County Health Alliance and what training looks like there.
Sure. So our workforce development efforts in Cabarrus County right now are really anchored in the foundational capabilities. And so we've been a part of our state's effort in really assessing where our workforce is striving and doing really well, but then also where our workforce needs a little more time and attention so that we can really focus and funnel our resources into those areas. And so we've really taken the time, we've talked with staff, we've asked staff to answer via surveys, and then we've gone back to see what those needs are so that we can bring those resources to them. And it's looked like everything from some very technical assistance. So we've done things like Excel 1 and 2 classes, but we've also done a lot of work around soft skills. So having those crucial conversations, how do you deliver bad news to community members in a positive way? And so we've been really pleased with the work as a whole.
Can you explain your process for improving recruitment and retention?
Sure. So understanding where we were doing well, but then also where we really had some deficiencies has helped us to tailor our job postings and to really conduct better interviews. So asking better interview questions. How do we make sure we are bringing those skills in-house that maybe we have been lacking? And so one of the really interesting projects we've worked on over the past few years is highlighting hard to fill careers in public health. And what we've asked real employees who work in those jobs every single day to do is really highlight the really fun aspect of getting to do those jobs day in and day out. But then also, what are some of the things that are hard and difficult so that we can really portray what it really looks like to work in public health day in and day out.
Jeff, Virginia also has done some creative work in this space. Tell us about the Virginia Department of Health Internship Academy.
Yeah, so our Internship Academy is a structured 10-week program that we administer during the summer. So it runs from May through July. 2023 happened to be our first year. But it really was set up as a way that to improve how we can provide internships in a very structured, framework-centered way that ensures that our interns are getting a great experience and our mentors are getting a really good experience at the same time.
What inspired the Academy?
Yeah, so it's a great question. Public health all across the country, I think, have always had internships, but they're sporadic. And it's highly dependent on if you have networks already, right? Do I have an external network of people that I work with? Do I have funding to pay interns? Sometimes we do, sometimes we don't. So it was very unstructured, but we wanted to create something that really provided a better framework for what we do and how we do it. And perhaps most importantly, removing the administrative burden for conducting internships themselves. We want our mentors to be really, really good mentors.
Relationships are another important piece of the workforce equation. Susan, why is it necessary to create more relationship building opportunities for the public health workforce in Nebraska?
I think that why it's so clear to me now that we need to spend time building relationships is because of how the pandemic played out for us. And really because of where we were most successful in the pandemic. We did not have relationships in place, and even though we were in full-scale emergency response mode, we made the decision to make our relationships a priority, make our relationships work. And because of that, we were able to accomplish a lot more during the pandemic and since then than we would have been without it. People do the work of public health. If you don't have people connected to one another in productive ways, the work doesn't get done, or it certainly doesn't get done the way it should. So I think that the pandemic was really a great opportunity for us in some ways to live up to our better angels and think about ways that we could work together, stay engaged in conversation. During the pandemic, we had no option to opt out of conversations and walk away angry. We really had to stick with it. There was no other option. So, and I think that those relationships became really the core of how we were successful in our response.
The Nebraska Division of Health hosted retreats as part of the relationship building process. How did those help improve relationships?
The retreats started in, I believe it was November of 2020. And at that point, that retreat was the first time that many of the people who had been working together on the pandemic for about a year at that point had ever been in the same room together. So it was a really good opportunity for people who only knew each other in Zoom to get to know one another. And it was also our opportunity to start to think about a vision of what public health would look like when the pandemic was over, which was a welcome reprieve, honestly, even though everyone was very busy. And so the goals and vision elements that we came up with at that retreat continue to drive our work today, and also were, as happenstance, ready for the 21C application that came, that I think it opened in February of that following year. So just a few short months later. And that has been the origin of a lot of the work that we've been able to do since then. We've since that point, I think, reconvened 3 times, and it's been different groups of people, always from local public health and local and tribal public health, local and state public health. But we've reconvened several times, at times trying to focus on elements of the vision, and at other times just to really kind of check in on where we were with our work and with our relationships. There's a lot of attention paid to relationships during those retreats, activities that are intentionally designed to help people grow closer, or certainly develop a knowledge of one another that helps them to be better collaborators going forward.
Erin, back to you. Thinking about your work in Cabarrus County, what role has equity played in your workforce development plans?
So diversity and equity really is something that we have tried to thread within all of our public health work for a long time, but there's really been a renewed interest over the last several years. Of course, the pandemic highlighted the need for us to double down on those efforts. And so for us in Cabarrus County, it's been really important that we've taken a look at our workforce beside those that we're serving, and how are we making sure that our workforce mirrors those that we're serving? How do we make sure that we have individuals that can connect with our community as a whole, with our patients and our clinics? We have a fairly large bilingual population, or individuals who only speak Spanish in our community. So we've really worked hard to recruit staff who have that as their primary language, so that we don't have to rely so heavily on interpreters, because we know that that's a better connection. We know that we're going to see better outcomes. We know that we're going to see those patients coming back to us. And so, we have really had a renewed effort, a lot of staff training around equity and inclusion and diversity over the past several years.
Jeff, looking ahead, how will the Internship Academy benefit your agency and others as public health works to rebuild the workforce post-pandemic?
Yeah, it's a great question. The Internship Academy's success from 2023 is really beneficial to us because we had over 400 applicants and then 26 interns, we're using distribution lists from both of those to reach out to prospective applicants for our future positions, which is great. We've already hired 3 people from the academy into full-time positions, which is really good. And those students are becoming kind of the difference makers for us, right? We know that college students today really are looking for positions where they can make a difference in their communities. And they are becoming our advocates via social media, etc. Anytime we post things about the Internship Academy, they are out there in full force, helping us wherever they can, encouraging people to reach out to them. So it's been really good from that perspective, and I think we'll see that continue as we move forward.
Thank you, everyone, for being with us today. You can visit the show notes for more information on how workforce development tools and strategies like these can optimize your public health system. On behalf of everyone at the FAB Center for Innovation, thank you for watching.